Between two floofs. Between two floofs.
Okay, you guys need to settle down.
Oh, they won't.
I think the most interesting.
Can you get a dog trainer?
My name is Karen Reagan. I'm a veterinarian here at the Animal Hospital of Hyde Park.
Hi, my name is Andrea. I am the operations manager.
My name is Lisa. I'm one of the veterinary technicians.
My name is Eden. I am a customer support representative.
My name is Alex. I'm one of the veterinary technicians.
My name's Dr. Izzy Hergy, and I am one of the veterinarians here.
Dr. Kristen Dienst. I'm one of the veterinarians here.
My name is Michael. I am one of the ACAs.
My name is Cassandra. I am the lead receptionist.
So I'm Ellen. I'm the vet assistant here.
My name is Rolane. I've always had passion for animals ever since I was a kid.
My name is Dr. Amanda, and I'm the most recent addition to the team.
I'm one of the exotics vets. I also do small animal, including these two floofs.
I'm Ashley. I'm one of the registered veterinary technicians here. I must say I love it here.
Lie down.
We are a small animal and exotic animal practice.
I know the clinic's been around for a very long time.
For, I believe, 30 plus years.
The Animal Hospital of Hyde Park has been in Toronto since 1986.
To a new location that is purpose-built for exotic animals.
So we see everything from cat, dog,
cockatiels to macaws.
We have geckos, we have turtles, snakes, bunnies, guinea pigs, gerbils,
rats, ferrets as well,
pigs,
hedgehogs,
the chickens,
axolotls, salamanders, frogs, fish,
ducks,
even the odd insect.
Praying mantis.
And all of our vets are well versed in treating this diverse array of species.
Which is nice. Oh my goodness.
Really, it's always been animals.
I think it's the age-old story. Loved being with animals as a young child.
Like I've always been interested in animals and loved for like everything related to their care. So I mean, I feel like this has always been something I've wanted to do. I can't really see myself in anything else.
I think that it's a really cool profession that allows you to do so much more than most people can even imagine. Actually have the science and the knowledge and the authority to speak on their behalf.
I had a really great experience at this hospital 8 years ago. I brought my rabbit in for an exam, and the doctors did such an amazing job that I wanted to come back and I wanted to work here. It's very nice to watch them recover, to know that the first thing they see from being under is you.
Always had a big passion for all animals. Also always had a keen interest in science and medicine. So I realized that was a good career to combine both of those interests.
I love the human-animal bond and watching it develop and grow the way that I've experienced it in my life.
I don't see why I wouldn't take care of these little babies. It's where I get to take time out of it. Oh God. You kicked that off. You rude.
Ever since I was a little girl, always had an interest in exotics.
Very unique.
It's different. Every patient that comes in, it's a whole different story.
And it's fantastic to walk into every day and not know what appointment you're going into.
A lot of the times people don't even know that exotics can get vet care.
There's not a whole lot of clinics, at least currently, that work with exotics.
And they often run into more emergencies. So it's good that we're here for them.
I think all pets are family and all have the same values, so they really should always have the same standard of care as other animals do.
My experience brought me on this path of reptiles. So many people just don't understand how great they are and how much they deserve to be taken care of and loved.
No, come back, treat.
One is my stethoscope.
Definitely a stethoscope.
Oh, my stethoscope.
I have my stethoscope around my neck all the time.
Or coffee. I need coffee.
Coffee?
My coffee. If I don't have my coffee, it's the end.
Coffee is important.
My water bottle.
A good supportive team.
Our support staff.
My team. There's lots of laughter and camaraderie.
And a great pair of scrubs, obviously, to look good.
Just a good set of scrubs. It gets messy.
And kissing the patients.
seeing a serval, probably.
And for those of you who don't know, a serval is a wild African cat that can jump like 6 meters into the air.
Definitely a little scary.
And we had to figure out a way to sedate the serval so we could take x-rays.
Very like challenging because we couldn't actually like physically handle it.
After Regan take a lump off of bristlenose pleco's mouth, a type of fish. Yeah, went under anesthesia, and I think it was in its 20s, and I had this big lump on its mouth.
It was a budgie whose entire front beak was injured in some way, and then in the exam, it just decided to fall off.
Yeah, the most crazy and wild thing that we did see some lemurs to do full sedated exams and x-rays and blood work.
I was lucky enough to be involved in some koala research in just outside of Sydney, Australia, where we captured the koalas and we were able to run blood tests.
Cuterebra, which is where a larvae of a fly burrows under the skin of an animal and then kind of pops out through a little opening in the skin. I had that in a rabbit, which we were able to remove successfully.
We had a rabbit that came in that wanting to go into a plane. Yeah, it basically the whole eye was coming out of this eye socket every time you pick it up. We did opt maybe not to go into a plane because of pressure.
Hey, here, you can share. Come on, this one.
I would say definitely dealing with the grief and the death. Like not just the pet that's like having a hard time, it's also the owners.
And knowing you're saying goodbye to your best friend, helping them to understand that they're not a bad person for putting down their pet, but that they're doing the right thing.
I mean, some of these animals just have really poor quality of life, and it's not fair to let them suffer.
The owner, the vets, technician have been doing their best. It's the pet not making it after everything, after all your efforts.
Some things we just can't. We don't have the means to treat. We can't get everything fixed, unfortunately.
It does take an emotional toll. That's expected, but it doesn't make it any easier.
Really sad to see, but it's also nice to know that we can also like help to keep them comfortable.
Having to work in a privatized healthcare system where everything is monetized.
Trying to convince people that we're not in it for the money. We're recommending these diagnostics or medications to better help your pet.
And owners are faced with difficult decisions because of resource issues.
And where some people can't do what's needed for their animals, certainly having animals die and there was nothing more that you could do, that's a challenging thing to live with.
If we could, we would want them to live forever, right? Just trying to help as much as possible, but maybe not having the ability to.
A lot of heartbreak, sure, but you know what? That gets tempered with a lot of great stuff as well.
Basically, making sure you're doing your research
and get involved in all different aspects of veterinary medicine.
And volunteering is the best thing I could suggest to anybody.
Getting experience, being used to chaos, because it can be a very hard job mentally if you're not ready for it. It gets better, no.
Taking days where it's just for you is a huge thing for any job in veterinary.
I would say being open to new experiences.
Because it is such a broad and diverse profession. It can range anything from being in clinic to working on farms to working with Health and Environmental Canada. So there's really a world of opportunities.
Times we are so focused on actually taking care of the animal, but we have to always remember that pet has an owner. There is their family, so remember that the owner is there and he needs also that comfort and he needs that advice, because our job is also to inform.
My God, death now.
Yes.
When I walk in to do an intake, as soon as I see the pet, I'm already smiling, giggling. I really love a lot of the clients that we get that we've seen for years and years. They're doing well, their pets are doing well.
And the clients that are here that do remember you, especially going into appointments, especially when they know your name personally, it's really nice.
Patients come back for their rechecks and they're doing really well.
So seeing even like the love that the clients have for their small animals, like their rabbits and their guinea pigs, their turtles and their snakes.
Owner sort of getting into like a specific type of animal for the first time, but they haven't gone in blind. So this is someone who's done a good amount of research. They know what they're getting into. Pretty much everything I'm saying is already veterinary stuff that they know about and renders me irrelevant. But I do enjoy that knowing that this animal's in good hands.
Our great team and my coworkers, of course.
Like you literally come in the door and there's so many great people that you get to work with.
We're the best guys.
I've seen him with most of those things. I would say
A weird dude that does vet med. Like,
Just never know what their next move is.
nothing's wrong at all.
Sometimes you see the skin.
it's giving me goosebumps.
And I'll just run and cry afterward.
Comes out.